This presentation will discuss some strategies and tips for parents and families of children who have ADHD. Parenting is never considered an easy task, but having a child or children with ADHD can present some unique and often difficult challenges for parents and families. Children who have ADD or ADHD often present some behaviors that can be categorized into three main criteria. The first is inattentive behaviors. Inattentive behaviors include trouble concentrating on tasks and getting bored with them quickly, difficulty in staying organized, not paying attention to details, and misplacing items such as toys, books, and homework frequently. These are just a few examples. Hyperactive behavior. Although not every child with ADHD exhibits hyperactive behavior, it's often one of the most obvious indicators that a child may have ADHD. Some of these behaviors include constant fidgeting, running or climbing at inappropriate times and places, excessive talking, difficulty participating in quiet and relaxing activities, and trouble with staying seated at times when it's necessary or expected. Impulsive behaviors are behaviors that can often be very problematic in terms of maintaining self-control. Some of these behaviors include acting without thinking, interrupting others or intruding into their activities, trouble regulating strong emotions that may lead to outbursts or tantrums, and saying the wrong things at the wrong time. While these behaviors can be difficult and may seem impossible to manage, they're not impossible. Here are some tips to address inattentive behaviors. Keep a consistent daily schedule or routine. Keep your child's daily schedule consistent. Have them wake up, bathe, eat, leave for school, and go to bed at the same times each day. They'll know what activities to expect and when to expect them. Organize the whole house. Doing so can help your child learn to be more organized, and having places for them to put their belongings can prevent them from misplacing them, and important objects such as homework, books, and toys. This can help them to be more task efficient. Reduce distractions. Having a calm, quiet space in your home for your child to complete tasks can help them be more focused. Working in an environment with very few distractions can help them to complete the tasks in a more efficient way. Some additional tips to help with inattentive behaviors are to create checklists for your child to keep track of what they're doing with their homework or other important tasks. Instructions should be brief, and while completion is ultimately the goal, it's important to focus on the effort your child has put into completing the task. Here are some strategies to address hyperactive behaviors. Decrease screen time and increase physical activity. Children who have ADHD are often full of energy and need positive outlets to expend that energy. Swap screen time for outdoor playtime, or even consider enrolling in your child into a sport that they may be interested in. Modify your child's diet. Although it must be stated that diet's not a direct cause of ADD or ADHD, monitoring and modifying your child's diet can help decrease some of the symptoms of ADD and ADHD. Limit processed and junk food because fresh food is better for your child and for the whole family. Eat at regularly scheduled meal times and include snack times into the day. Doing so can prevent disordered and impulsive eating of food that aren't nutritious or beneficial to your child's health. Create buffers between highly active times and quiet times. Doing so can help your child to prepare for the more calmer environment of bedtime. Consider activities such as coloring or cuddling with your child while reading a book. Some strategies to address impulsive behaviors are to teach your child empathy. Many children are taught the golden rule, but many parents don't ask their children to view themselves as others may view them, or to encourage their children to practice self-reflection. Doing so can help your child to refrain from jumping to conclusions or wrongly interpreting the actions of others, which can lead to outbursts or tantrums. Model good behavior. Modeling good behavior and role-playing different social interactions can help your child understand the behaviors that are appropriate and acceptable in different social situations. Do not ignore aggressive behavior. Having a zero tolerance policy for behaviors such as hitting, pushing, or yelling can be a really good way to decrease these behaviors, but you must be consistent in punishing these behaviors with mild punishment, such as timeout or loss of privileges. And again, do not ignore these behaviors. Some other considerations are to focus on your child's strengths. Children with ADD and ADHD are oftentimes very intelligent, very creative, and very driven. Focus on what your child can do rather than what they can't. This will help them to develop the confidence that they need to be successful in life. Educate family members. Help other family members understand the challenges that your child with ADHD may face and appropriate ways to respond to their behavior. Discuss any issues that they may have privately and try to develop some solutions to these problems. These are my references and resources, as well as a link to my original Prezi presentation. Thank you.